This is Joe's cognitive behavioral treatment plan addressing his aggressive and obstinate behavior, compulsive stealing and truancy, as well as his maladaptive coping skills and lack of social skills. To begin, we're going to work on with Joe some cognitive restructuring techniques, helping him identify negative thinking, practicing metacognition, and developing some insight into his emotions, thoughts, and behaviors and their interaction. One way of doing this that I'm going to try is using some situational practice in session by looking at an event, the thought that proceeds from that, and the response that he has, and what some more adaptive responses or thoughts might be to help practice this within session, as this is a skill that he's going to need to build. Some other skills that may also be able to come along with this is by identifying and practicing some better coping skills that can be used, as well as challenging cognitive distortions. By doing this cognitive restructuring, we're going to come across, I believe for him, some core beliefs and schemas, including that he's not loved by the world, that he's alone in the world, and that adults cannot be trusted. And we're going to need to work on modifying those. One way I'm going to do this with him is for looking for evidence for these core beliefs and schemas, thinking of alternate ways of thinking about it, some alternate thoughts he could have, and as well as the implications of what those schemas mean for him, and have that be pulled into that cognitive restructuring piece. Finally, I want to do some goal and aspiration building with him by building some realistic self-esteem that is resilient. We can help find some goals that are accomplishable for him, and as well as exploring some inner strengths rather than outer strengths that may be able to lead to some better, more pro-social behavior.